Hello and welcome everybody. I'm very pleased to say that today we've got Caroline joining us, who is a Stoma Care nurse. And I always have a soft spot for nurses. I'm not sure if that's the right description, but what we really like at Talkcast is that nurses really help on the practical side of any issue. And I think that is really helpful because that, at Talkcast, we really focus on the self-care day-to-day of living with chronic health conditions. So I'm really excited to hear, Caroline, all the things you've got to tell me. Tell us. However, to kick off, what I'd first of all like to say is thank you very much, because CliniMed, who are one of the companies that we work with on a regular basis, have very kindly sponsored this event. Now, CliniMed, if you're not aware of them, and we do have quite a bit of information on our website about them, provide stoma care, wound care, and a full range of incontinence or continence products. And Caroline is from the SecuriCare division or part of it. I think CliniMed, it's part of one of your companies, isn't it, Caroline? You can explain it more, as I managed to botch that one up. But yes, you are the home delivery side of it and the source of the day-to-day support. So Caroline, please tell us very quickly about SecuriCare, and then once that's the commercial bit over, we'll get down to the nit grit.
Yes, yeah. Thank you, Katrina, and it's lovely to be here with you all today as well. Yeah, I work for SecuriCare, and that is the nursing side and the home delivery side that is linked to CliniMed, who distribute the stoma products. We use Welland products, and we have a nurse team who are based around the UK, visiting patients. They work in hospitals and they work in the community. And then our patient services side deliver products from any manufacturer to our patients.
And just to say, as with all of our webinars, this is not a sales tool for CliniMed or SecuriCare. It's just they kindly sponsor it. So from that's it, we're not going to talk about any specific products at all. We're talking very much generally. We're here to support those who either have a stoma themselves or people that care for someone with a stoma, or somebody who's actually just interested in the subject. Because the good news is that there's far more awareness, I believe, in the market now around stomas, and hopefully the stigma of having a stoma is becoming less, and people are far more open to understanding the issues of living with a stoma. So, Caroline, would you like to kick off by explaining to us, your role as a stoma care nurse, what that implies, and maybe a bit about your own background?
Yes, yeah. A Stoma Care nurse is a registered nurse who's undergone additional training specifically in stoma care. And there's various qualifications that we can take to enhance our own knowledge and practice. We see patients before they have their surgery. That might be when they've been diagnosed, when they've seen a consultant, and they know that they're going to have a stoma formed, and we can give them a lot more information at that stage. Or it might be someone that's just been diagnosed with a disease, maybe an inflammatory bowel disease, and has heard about the potential of having a stoma and just wants to be a little bit better informed, should that be the road they follow. When we see patients preoperatively, we go through what their surgery entails, what they should expect. We look at products, the different types of products. We talk to them about health and well-being, getting them ready to go home, how they can resume their normal activities. When they're in hospital, we see them during their time in hospital to help them manage their stoma and prepare for going home. And then when they go home, they're visited by a Stoma Care nurse. That may be the same nurse that looks after them in the hospital. Some nurses have a joint role of hospital and community. Other times it's a different nurse that is purely in the community but links very closely with the nurse in the hospital. So there is very much a continuity of care. And we're really the person that will come and see you when you're managing well, We try and leave you to live your life as you wish to, but we're always at the end of the telephone, so that if you have a problem or you have a concern or there's anything that you just want to ask, we're there and we can help you out and hopefully resolve any issues or concerns that you have.
I'm sure that's really reassuring for people, because it's very frightening, and it is a life-changing thing.
It is, and I think we talk about preparing people, but like anything, it's very hard to prepare you for every eventuality. We can tell you about the most common things you might experience and how you would deal with it. But I think, yeah, it's often when something out of the ordinary happens, and people often have a bit of a panic, they just want to know there's someone there that they can call and say, is this normal? Or it may be something as simple as they're planning. It may be something as simple as someone's planning their holiday. They haven't been maybe on an aeroplane with a stoma, and they're doing all their planning, they're thinking about the holiday, and suddenly they think, what should I be doing about a stoma going away? So it's just sometimes those questions that come into people's minds, and it's knowing that there's someone there that they can call that will be able to help them out.
I mean, the first thing is about adjusting to a stoma. So, and as you said, how do you adjust to, I know that from personal experience within my family, that for a close relation of mine, he was told he had to go and have a temporary stoma. So that's kind of, that was good, because the care was great. They helped him understand it before it happened. But for some people, presumably they wake up having had some emergency operation and they have a stoma, and maybe not even know what a stoma is when they wake up. And that must be, apart from all the emotional shock, that it's quite traumatic.
Yeah, I think you're right. Everyone is an individual, and that's why we have to tailor the information we provide to everyone's needs. It is much easier if you can prepare people, because I think, if we know what to expect, it makes things a lot easier. So you're right, when someone wakes up from surgery having no idea that they were going to have a stoma, it is a complete shock, and they may not even know what a stoma is. They may not have heard about it. Research will tell us that it does take a little bit longer to adjust to a stoma when you're not expecting it, because it's all the emotional side. There's a lot of the emotional and psychological side involved in stoma care, and I think particularly when you're waking up, it's a fear of the unknown, if you like. So we spend a lot of time with people who have an emergency stoma, trying to explain, trying to reassure them, making sure they have all the information that we would have given to everyone else before surgery, and take them through step by step. So there's always someone there sort of guiding them through, making sure that they're okay.
And this kind of care of before surgery, is that's available on the NHS and privately both, presumably?
Yes, it is. The NHS and private work very closely with Stoma Care, and sometimes in the private sector, they will use the local NHS stoma nurses for that care. Yes, it's a very important part of our role to make sure that people are prepared for surgery. And so as stoma nurses, we work very closely with all surgeons, making sure that we do get informed when people are planning to have stoma surgery, so that we can prepare them. And it's not only passing on the information, but we also mark the stoma site before they have surgery. This involves looking at the body, looking at the most appropriate area to site that stoma. Everyone has a different body shape. We want to make sure that the stoma is not positioned in a big dip or a crease, because that could increase your chances of leakage once you have a stoma. So we're looking at that. We try and make sure it's underneath the clothing waistband if we can, because again, if it's positioned right where you've got a waistband, it can be a little bit uncomfortable. If we can put it slightly lower, so it's a little bit more hidden underneath clothing, then that makes it easier. So we do mark a site with the agreement and consent of the patient beforehand. And the surgeons will, if they can, put the stoma in that position. Now, of course, sometimes things happen during surgery. They can't always mobilize and move the bowel to the position we ask them to put it in. So it isn't a guarantee, but where possible, they will put the stoma in that position because they know that's the best position for the person.
And I suppose that's sort of reassuring when you're having an operation, is that you know where it's going to be, so you can start thinking about it. So, just can we just quickly just do that bit from the point at which you wake up? What, I don't want us to spend too much time on it because obviously it's a narrow part of the conversation, but what happens?
Yeah, so once the patient's had their surgery and they've gone back to the ward, they'll usually be on a colorectal ward where the nurses on that ward are familiar with stomas, and they will have had additional training from the Stoma Care nurses so that they're well equipped to help support with stoma care. There will be a bag provided for the patient. It's usually in the form of a wash bag, and that will have some stoma pouches in it. It will have some rubbish bags. It will have some wipes. It will have a little pot so you can put some water in it. And it will have anything else that's appropriate. So some patients use adhesive removers. We often use these when patients first have a stoma formed because they cause less trauma to the skin when you're removing a pouch. So all patients will have their own wash bag, and the stoma nurse will keep that topped up for the patient while they're in hospital, making sure it's got the right products in it for that patient. And for the first few days, the nurses and the stoma nurses will look after that stoma. So as it's filling up, the nurse will come and empty it, because we know that's something that when you're first coming around from surgery, you're feeling a bit drowsy, you don't know how to do it and you're not really aware of that. But as soon as possible, we start trying to put the patient in a position where they can self-care. So we're teaching them. So the very next day, we will be going up to the ward, changing the stoma bag, showing them how we change it, how we empty it, and getting them to start practicing with us. And I think, like anything, the more you practice, the more you get used to things. A lot of the time in hospital is, I would say, a very physical element, because we know now people don't stay in hospital very long. There's all this around early discharge. They try and get people home as quickly as they can. So very much the focus in hospital is about trying to get people to be able to...
Sorry.
All right, it's typical. To be able to manage.
Let me just go and turn it off. Sorry.
Yeah, no, that's fine. No worries.
It will be one of those rubbish phone calls that we all get. But I get one a month. Hopefully it will turn off.
They've gone. Yes, so a lot of the time really is trying to go through the practical side, because what we want to make sure is before someone goes home, they're fully capable and competent and feel confident about managing their stoma care. Obviously, the psychological side comes into it a lot, but I often find that patients almost feel they're on bit of a turntable, if you like, while they're in hospital. Lots of things are happening and they're just trying to get used to it. When they get home and they sit down and they sort of process what's gone on, then it's often that they think about lots of things and have a lot more questions, and maybe think about the psychological effects of having a stoma, and maybe their future lifestyle, about how they go out with the stoma, how they, go to restaurants, go on holiday, all those sorts of things.
And I suppose, the early stages must be really important to enforce the positivity of you can still lead a normal life, and to give them the confidence to be able to be self-sufficient.
Yeah, you're right. And if we've been able to see someone before they have their surgery, we always offer them the opportunity to speak to someone who's got a stoma, trying to match them with someone that's similar. That might be a telephone call. It might be, some people do like to meet up, and we do that in a very safe environment if people want to meet up. But it's about, sometimes they have questions that they want to ask someone who's living with a stoma, so they can give their own experience. In hospital, we often find, you know, there's other people on the ward that have a stoma, and people do share their experiences and what works for them, what's good for them. There's often people that maybe have a stoma that have come back into hospital for something unrelated, and they're living their usual life with a stoma, and they're able to share that positive aspect with people. And we know there's ups and downs, as there is for everyone in everyday life, and the stoma can make that more difficult. But we also know there's an awful lot of people out there living very fulfilling lives with a stoma, and you wouldn't even know they have a stoma. It's not something they think about. They're just that person with a stoma, and they're living the life that they were living before, and often a better life, because particularly if you've had an inflammatory bowel disease, you may have been, before your surgery, you may have been going to the toilet numerous times a day and found that you were scared to leave the home without knowing where the next toilet is. So suddenly having a stoma can give you a little bit more control over your life, and you can start living again.
Oh, that's exactly what I was going to say. You know, we're sort of talking about the negative side of it, but the positive side, for lots of people, it gives them back their life by having a stoma, and it's a big decision to make. But you know, this is not going well. My cat, who I had locked out, managed to get in, is now trying to jump over it. So when I'm going like that, that's what I'm doing. It's going to be one of those days, I can tell. So, you know, you've got into your routine, and I suppose it's finding the right products for you. So, I mean, is there a big difference of products for people? I mean, I don't know. I don't know very much. I mean, do you have big bags, small bags?
There's a number of different manufacturers, so there's quite a lot of choice of stoma bags, and we try to offer that choice to a patient, because ultimately, if you're wearing the stoma pouch, you want to make sure you're wearing something that's comfortable for you and that suits you. We're all different shapes, sizes, tall, small, etc. So there are different pouches around. Depending on the type of stoma you have, if you have a colostomy, you may have a closed bag. If you have an ileostomy, you'll wear a drainable bag. And if you have a urostomy for urine, you'll have a bag with a tap. Now, sometimes people interchange closed and drainable bags, but that's sort of the general. And within that, there are different types of products as well. So we have what we call one-piece bags, and we have two-piece bags. Difference simply is a one-piece bag comes all in one piece. So it has the flange, which is the sticky part that sticks to the tummy, and the bag actually attached all in one piece. They tend to be sort of quite low profile, very flexible pouches, but when you want to change it, you change the whole pouch. The two-piece pouches, as it says, come in two pieces. So you have a flange that's separate to your bag, and you either clip or stick the two together. What that means is you could put the flange on your tummy, that can stay there for maybe 3 or 4 days, and you can change the pouch without having to change everything on your stomach. Again, that's personal preference. Sometimes that's around lifestyle as well, whether people want to have a one-piece or a two-piece bag. And then we also have different styles. So there's larger ones, there's medium size, there's smaller ones. We have them in different colours. They can come in clear. They come in like a tan sort of beigey colour. And then more recently, we're seeing bags that come in a black or a white colour as well.
I've seen them with flowers on them as well, because some of them get quite pretty, don't they?
Yes, and you can have pouch covers. There are people,
right, maybe that's what it is.
Yeah, there are people who make pouch covers, and you can use a variety of different materials. And I know some people make their own pouch covers, and they'll put them across over the top. And the idea of the black stoma pouch, it's about maybe trying to mix it in with your underwear. We know that people wear different colour of underwear, so black and white is quite a popular colour of underwear, so there's these black and white pouches around as well. And often people start off with a bag that's very flat, and that's sort of the regular type of bag, but sometimes people do experience some issues. Their stoma may retract or pull back a little bit, go very flat to the skin, and then we might use what we call a convex base plate, and that just has a little dip, so it almost sits into the stomach and lifts the stoma forwards. And that's the idea. Sometimes if a stoma pulls backwards, someone can leak, because the output might leak underneath a flat flange. So by having a bag with a degree of convexity, it actually forces the stoma forward, so it should help to relieve leakage problems. And again, convex bags, they come in different sort of strengths of convexity. So there's a very flexible, soft type of convex. Sometimes people do use these straight after surgery as well. And then there's a more rigid, harder convexity. They may be a little bit more uncomfortable to wear, but if you're leaking and that stops your leak, then actually, it's perfect for you, because, nobody wants to experience any issues.
And so presumably, is it the size depends on whether you want, maybe, I don't know, is it you have a bigger one for nighttime, or because you're going out, or maybe you're going out and you might be not wearing very much, so you'd only have a little one, but knowing you have to.
Sometimes, again, it's very individual. The majority of people, I would say, have one stoma bag because they don't want to keep changing it all the time.
Oh, yeah.
Now, a lot of people initially, and I would say, the tendency, men want larger bags, women want smaller bags. But when people think about it, if you have a smaller bag, you have to go and empty it more often. So again, it might depend on your lifestyle, what you're doing, how often you want to go to the toilet and empty it. Also, if it's a small bag and it fills up, you can maybe see it bulging out a little bit, whereas a larger bag, as it fills the same quantity, it might have a slightly lower profile. So it really depends on what people want to do. If you have a two-piece bag, it is easier to change the bag rather than taking it all off. And we do find that some people, yes, they will in the daytime maybe wear a standard length bag, and if they were going out at night, they might put a smaller bag on, or particularly if people are going swimming, they might put a smaller bag on. They may think, well, I'm going swimming for an hour or two, a small bag will do, and then they might change when they come out. But again, it's very much about people making the right choice for themselves. And as stoma nurses, we're here to be able to help provide that choice and guide people so that they know what their choices are.
And I think you mentioned swimming, because I was thinking about sport, whether that was one of the things to have maybe a more flexible one than the hard one.
Yes, and I think often that is the case, particularly if you're doing something where you're bending and stretching a lot. Some people find that a one-piece product is a little bit more flexible, so they prefer that product. There's always people that don't, so it is about finding what's right. There are some stoma guards around. Some companies produce, it's like a plastic guard. And I know some people who play rugby or very contact orientated sports do choose to have a protection over it. Other people say that they don't like a protection because if they do get hit, they feel that the plastic actually digs into the skin and causes more damage than if they hit their stoma. And a friend of mine, she does a lot of cycling. Shortly after having a stoma formed, she was out on a bike, hit a pothole, went over onto the over the handlebars, and she said her first thought was, what's going to happen to my stoma? But she said that was absolutely fine. She was bruised everywhere else, the stoma was fine.
And I suppose also one of the other things would be is to start, once you've got accustomed to your stoma, is not be frightened to go and try other stoma, is to go and experiment maybe to find the one that fits you. And if you're not happy with what you've got, don't just feel that's the only answer because that's the only one you've tried.
You're absolutely right. I think a lot of people, when they're discharged from hospital, they think that the bag they're discharged on is the only bag that's
it. Yeah.
And if they're not seeing a stoma nurse regularly or they're not aware, they maybe don't know there's other things to go and look at. I often think it takes you a few months just to settle down, to know what you want. And then I would always encourage people, particularly in this day and age where a lot of people go online, there's a lot of companies out there, go and have a look what types of products they do. They will all send you a sample. We just have to make sure it's the right type of pouch for you. So a company will send a like-for-like product out. If you were requesting something that isn't like-for-like, they would want to speak to a stoma nurse just to make sure that it is the right product for you, because we have to be safe in this situation. But yes, you're the best judge of what works for you. So I think, yeah, have a look what's out there. Also the associations, Colostomy Association, Ileostomy Association, Urostomy Association, they have a lot of information on their websites. They produce magazines, people advertise in them. You'll see what's out there. And I'd encourage you, try the samples to say what works best for you. Maybe check with your stoma nurse if you're not sure, so that they can give you the guidance and say, yes, it is the right product. Stoma pouches, there's also a lot of accessory products out there, and sometimes you don't need the accessory products. So that again is where stoma nurses can be of a real support to people, because you can go and order some samples, but the GP may say, I'm not sure you need it. Does it need to go on your prescription? So the stoma nurse can really give some specific advice around what it is and isn't needed for people. Ideally, we try and keep things as simple as possible. It means that when you're changing your bag, if you have a simple routine, it's really quick and easy, rather than having lots and lots of steps because you've introduced lots of different products.
And as you were talking, I was sort of thinking, and interesting enough, you were answering my questions as I was sort of going along, is that clearly it's a minefield, and it's a bit like you go on the internet and you go, oh, well, I've got that symptom, and you do a self-diagnosis. And it sounds like that because there is a lot of information out there, but really where it sounds like your role is so essential in talking to someone. So you might read about it, but still may not be appropriate because you might have just missed some particular information about the condition or the reason why you've got that stoma, as to whether that is appropriate. So I can see that talking to somebody in real life about your own situation is paramount in experimenting.
Yes, I think you're absolutely right. And often there's a lot of forums and people speak to each other, but I think having a stoma nurse that you can contact means that you know you're getting the right information. So, for example, someone may say, they've got a loose output, they've got a bit of diarrhea. That may be different. Someone else may say, oh, I had that and I did this.
Yeah.
If they've got a different type of stoma, then maybe their treatment will be different. So it's about making sure that, yes, someone's giving you information for them, but it may not be appropriate for you. Whereas the stoma nurse will be able to give you that information. Absolutely. And I think when we come down to products, again, we're working with all the companies. We speak to all the reps for all the companies. So we know all the different products. So if you're experiencing an issue with one type of product, we know what else we can suggest for you.
Oh, I think that's just so reassuring, for sure. So I was just sort of looking at, because we've got a little menu as to what we were going to talk through, because I think there is so much and so many different sort of combinations. And, we're going to talk about some of the common problems, and this word pancaking comes up. What is pancaking?
Yeah, pancaking is, it's a strange concept. You usually get this if you've got not usually, the people that may have pancake pancaking are usually people with a colostomy. So they have a fairly formed stool. And what happens is all the pouches have filters, or most of the pouches for bowel stomas have filters in them that allow gas to come out, because whether you've got a stoma or not, we all pass wind. And if you've got a stoma, it has to come out somewhere. So the filter allows that to come out. Now, sometimes some filters filter the wind out a little too quickly. And what happens is it creates a vacuum in the bag. This can be made worse if the poo is a little bit sticky. And it's difficult to explain that in any other way, but maybe if someone's diet, their outputs become a little bit looser and the poo's a bit sticky, it sticks at the top of the bag and doesn't drop into the bag. And pancaking makes that much worse because the vacuum in the bag, again, doesn't allow the space for the poo to drop down. There's various things that you can try. Success rate varies with different people, and pancaking is one of those things that what works for one doesn't always work for another. So sometimes putting a little bit of oil into the bag just so that it's slippy, if you like, so that the poo can drop down. Some people put a little ball of tissue paper in the bottom of the bag just so it makes sure that the two sides aren't touching when you put it on. Some people blow a little bit of air into the bag before they put it on. If there's too much air coming out, sometimes people use a filter cover, which is a little bit like a sticking plaster that goes on the outside of the bag, and it stops the filter from working, so it does keep some air in the bag. So lots of different things to try. All different companies have different filters as well. So if you pancake on one bag, it may be that trying a different company's bag, you may find that you don't pancake on that bag.
Oh gosh, I mean, and that's really good advice. And what sounds obvious, but I'm sure that until you come to these problems, you don't know. And what sort of other? I know that sore skin. I know that is a big issue, isn't it, or can be?
Yeah, sore skin is probably the thing we get called about most. Sore skin and leaking. And often they do go hand in hand. When you have your stoma first formed, it tends to be a little bit swollen. So like anything, you have an injury, you get a swelling. And when you first form the stoma, it's often a little bit swollen. So we know that generally in the first 8 to 12 weeks of having a stoma, it will shrink in size. And it's important that where you're cutting the stoma bag out, that as the stoma shrinks, you start cutting that hole smaller to protect the skin. And that's the most common cause we see, where people haven't either been taught how to or told how to cut their bag a bit smaller, so they're carrying on with the same size hole. And what happens is, as the poo or the urine comes out, it sits on the skin before it goes into the bag, and it makes it very sore. And it's a little bit like a baby, you know, if they have a loose nappy and they're sitting in it, they get very sore skin. So we use lots of creams on our baby's bottoms. The same with the stoma bag. If you've got exposed skin and it's constantly exposed to urine or stool coming out, it will get sore. So the easiest solution and the most common solution is that we just have to resize the template. We tend to teach people how to check that template. If people can't cut it themselves, as long as we've told them to check how to know if it's getting too big, at least they can contact their stoma nurse and ask them to go and resize the template. And we always go and do that for people. Other causes of sore skin might be that someone's got a leakage. And again, usually that's something that's changed around their stoma. Maybe as you're eating better, or if you're not eating well, you lose or gain weight, and you may get different creases, movements in your skin. And sometimes those creases can just cause a problem, and the output will sort of creep underneath the skin. So there's lots of reasons for leakage. And again, if you're having leakage, contact a stoma nurse. They can give you some advice, because if you do get sore skin, it obviously makes it much harder to get a bag to stick on that sore skin. And And also, we don't want you to be uncomfortable. No one with a stoma should be having sore skin and feeling uncomfortable. So we want to make sure that's resolved.
Right, so I was going to say, so treating the sore skin is through putting something, some kind of, is it an emollient or?
It depends how bad the sore skin is. So sometimes if it's just red and soreness and you just need to cut a better template size, you don't need to put anything else on there. You can just do a new template and the skin will heal itself underneath the pouch. There are some pouches out there nowadays from different companies that have things inbuilt into the pouch to protect the skin. So we see things such as Manuka honey, aloe vera, vitamin E, various things that are designed to protect and keep the skin healthy. If the skin is sore and it does need some treatment, then again, there's different things. So we see barrier wipes. They can help to heal and protect the skin. It may be that we use a powder if we need to heal the skin. That's a specific type of powder that helps to heal the skin. We have to be very careful with putting emollients on, because what we don't want to do is stop the bag from sticking. So there are some creams out there that are designed specifically for use around the stoma, and they won't affect the sticking of the bag. So again, it's about making sure you've got the right type of cream, which a stoma nurse can advise. And usually when we're telling someone to put one of these creams on, it's about using a minimal amount, and then often I get a dry wipe just to dry the surface once we've put the cream on, to take off any greasiness before you put the bag back onto the skin.
But the main thing, or the main takeaway from that, is actually sorting out why you're getting sore skin, as opposed to the skin will sort itself out.
Yes.
You've got to sort out the reason why you're getting it.
Yes, yeah. Once you know what the problem is, we can find the solution for it. And yes, you may need some treatment in the short term for that sore skin, but that usually is a short-term issue. And again, it's good to make sure that if you are having to use extra products when you've got sore skin, to know when to stop using them when it's healed, because again, no point in putting things on if you don't need to put them on.
So I'm just looking through the things, and I think we've gone through a lot of, you've very kindly mentioned all the things. So I'm very aware of Manuka honey with stomas, and I sort of never really looked into it enough to understand. Now I understand exactly why. It's the healing properties, isn't it?
It is. It's used in wound care, and this is where it developed. Manuka protects the body against bacteria, and it helps the skin to heal itself. So yes.
No, it's great. So then, looking more at sort of lifestyle stuff, we've mentioned exercise, and we've spoken about having different kind of bags. And I know that diet is obviously an important part, because that's what goes into the bag.
Yeah, and I think sometimes we can become very focused on diet. The old-fashioned way, and when I started Stoma Care nursing, I've been a Stoma Care nurse for over 25 years, we used to have booklets with lists of food that we would tell people they should or shouldn't eat. Nowadays, it's really very much about trying to get people back to their usual diet. There are some things with an ileostomy, which is a stoma from the small bowel, that we do suggest people don't eat, or make sure that they chew very well. These are things such as nuts or sweet corn or peas traditionally. However, I also know a number of friends with a stoma that do eat those products, but they just chew them very well. But traditionally, we will tell people maybe to avoid those products. They don't get digested, they can block the stoma, and they can cause you an obstruction, which is very uncomfortable. So the majority of people would choose to avoid those types of food. But everything else, we try to get you back to eating what you used to eat, what you normally eat, getting back to a normal diet. So, some people eat a very bland diet. because of their stoma. They don't have to. There are people out there eating very spicy food and they don't have problems. But again, everyone's individual. And what I tend to say to people is, if you experience a problem, then think about what you've eaten, maybe give it a few days rest, then maybe try it again. If you experience the same problem, you may find, yes, that food does affect you, but it may just have been a one-off. And again, everyone's different. I speak to a lot of people. Apples is something. Some people can eat apples whether they're raw or cooked, and they can eat the skin. Other people can only eat them without the skin. Other people can only eat them cooked. And again, I think it's just, we're all different. So it's finding out what works for you.
And that's really nothing to do, quite honestly, is it, whether you've got a stoma or not? And it's just understanding and being aware of your body and how your body reacts.
You're right. I think, that there are more things with the stoma that perhaps people might find makes a looser output. So again, it is just being aware, because, it doesn't always affect people.
And maybe to expect, if you were suddenly going to eat something hugely spicy that you would never normally do in your normal diet, you're going to have a reaction, or something's different's going to happen.
Yes, and I think that's right as well. It doesn't mean you can't eat it. If you eat something spicy and it does loosen your output, we hear in general, sometimes people eat a curry, they need the toilet a little bit more frequently. Again, if something like that happens, as long as you're aware that you might need to empty or change your bag more often, it's not an issue. It's just that you've just got to go and change the bag more often. So it's being aware of how your body reacts to different foods.
Funny enough, I don't normally read out questions, but somebody said that they find that vegetarian food and I better put my glasses on because I'll be guessing, acid pastry, give me raw wind and cause the bag to float. Now, bloating, is that another issue with bags?
Yes, people do produce wind, and as we know, certain foods can make you produce more wind. Again, I think it's very individual. Typically people talk about baked beans giving you wind. For some people it does, for some people it doesn't. But there are lots of things. People will often say onions give them wind, but again, it doesn't affect everyone. And you're right, more of the fruit, the vegetables, the vegetarian, the grains, etc., can give you more wind. But it's not necessarily the case. It can also make your output a little bit more liquid, certain foods. So, for example, some people say to me they can't eat salad. It makes their output quite liquid. But what some other people will do is maybe eat something starchy with the salad. So they might have some potatoes with the salad to try and counteract. So it's just being aware of what you can eat and what might balance things out.
And salad is watery, isn't it? So
it is. That's it. So it's about putting something with it that maybe thickens it up. And there are certain foods that we know will make an output thicker. Particularly if you've got an ileostomy, which has a liquid output, there are certain foods that people will eat to help thicken their output. So that might be a white bread, which is very starchy, plain biscuits, because it all absorbs water. So it does help to thicken things. We know gelatin helps to thicken things. So we often talk about eating marshmallows.
Oh, that's just come in.
Haribo sweets, has it? Yeah. So again, that sort of gelatin will thicken an output. And again, it's about using it to titrate what's happening for you. So yes, yeah.
The person who very kindly said a tip they did say when you're drinking alcohol. I suppose that for lots of people that's an important priority to work out how you can.
Yeah, and I think that's it as well. You can still drink alcohol with a stoma. Again, it may affect you. You may get a looser output. If you've got a urostomy, you may have to go and empty your urine more frequently. I usually say to people, as long as you're capable to empty your bag, then you're fine. So, essentially don't drink too much that you can't go and empty your bag. but otherwise you're
Yeah,
fine.
handy hint.
Yeah. And again, you know, some of the fizzy sort of drinks, fizzy drinks can give you more wind.
Yeah.
So, you know, often people choose not to drink fizzy drinks, or if they want it, whether that be, say, a Coke, or whether it's something like champagne or something, maybe just let it stand for a while so you haven't got the full fizz and it's just died down a little before you choose to drink it.
Okay, so a few things that I'm keen to get through, because I'm just sort of aware of time suddenly catches up, is so we've spoken about diet, traveling with a stoma. So for a lot of people, I can imagine, you know, they might put off traveling because of they may have been, you know, due to ill health and the reason why they've got it, and then suddenly they can now travel, and how frightening it must be to suddenly think, oh my gosh, I don't know where the nearest loos are, I don't know how I'm going to. What are the hints that you help people to overcome those things?
I think there's a lot of advice available and a lot of booklets from many of the companies. So there is information out there, and on the websites, and the associations will help with that. But often it's about being organised and prepared. So particularly if you're going abroad, we always say to people, just take more pouches than you think you're going to need, because you know, you might find if you're going to somewhere hot, the bag doesn't stick as well, or you need to change it more often, or if you're eating different food, you may find you need to change a bag more often. So we usually say take more than you expect to need, just so that you're not going to run out. It's about, we usually say if you're traveling, take it in your hand luggage, if you're flying in particular, again, just so you don't get to the other end and find, you know, your supplies haven't arrived. There are certificates you can get. Again, the companies or the associations will have certificates written in other languages, so you can show someone at the airports, wherever you're traveling, that you're carrying equipment for medical use. I think it's about just thinking about foods and water that you're eating. You know, is the water safe? If you're going to be drinking bottled water when you're away, think how that translates into ice cubes as well. So if you're having a drink that's got ice in, that may not be bottled, that may be from a tap. So again, if there's a risk that could upset your tummy, just think about those things. But generally, you know, there isn't an issue. People travel with a stoma and don't have any problems. There are some radar keys that can give you access.
Yes, I was going to mention those,
to accessible toilets. Now, some people choose to use them, some people prefer not to. But the idea is with an accessible toilet, it has a bit more space in there. You've usually got somewhere that you can maybe put or hang some stoma bag, your equipment. You've got a sink in there. So it's a little bit easier and a little bit more space if you had to change your stoma appliance. But again, some people just don't want to use a different toilet. They prefer to go into the regular toilets. Also, when you're going out just for the day, or going back to work or going to visit a friend, it's about having a small supply of stoma equipment with you should you need to change your bag when you're out. So all the time, it's just being prepared like you would if you were, say, a diabetic needing some insulin. You'd always have some insulin with you. So it's just about being prepared. And sometimes, you know, it's just that fear of sleeping in a different place, going to visit a friend. Will they know you've got a stoma? You might not want to tell them, or going to a hotel room and having a stoma. Again, there's lots of information we can support with. There's lots of bits and pieces that can help just to reassure you. And lots of people that have travelled that are more than willing to share their experiences.
And the other one, which is that, you know, and I'm sure is the one that people potentially do struggle to talk about, is relationships and intimacy. You know, it must be so difficult as to know, especially if you've got a new partner, how do you bring up the conversation about, you know, because it's not as if you've got anything written on your forehead. Most of the time, as we said, you can't see anything.
It is. It is a very difficult subject, and it's something that Stoma Nurse will always talk to people about, and they're always open to those conversations. Again, like anything, it's very individual. Some people have been with a partner for many, many years before they have a stoma, and that's a very different conversation to having a stoma and finding a new partner. Some people want to tell the new partner straight away just so they know. Others want to wait and see how they get on, whether they like each other before they decide to tell them. And there is no right or wrong. It's what you feel comfortable with. But there are also hints and tips we can say, you know, when you are going out with a new partner, it might be about wearing, you know, different underwear. There may be things you can put on that perhaps hide the pouch, so it's not so obvious, that makes you feel better. A lot of it is about how you feel about yourself as well, and how confident you are. You know, other things around just emptying your bag before you're going to have sex with someone, so that you're not worrying about that. So lots of different bits and pieces, but it's very individual, and I think it's very individual as to where you are in your relationship. But Stoma nurses have had those conversations with many, many people, and they're very comfortable to talk around those conversations.
And I'm sure a lot of it must come from you. If you're confident about it, that then gives the confidence to your partner. So though you might have been with your partner for a very long time, they may be going, oh my goodness, I don't want to hurt you. I don't, you know, all of those, I imagine, concerns.
I think you're very right. People often say, I don't want to cause any harm to you. I don't want to hurt you. So again, it's about finding what works, speaking to each other, you know, making sure you say, no, that's fine, this works. Sometimes it's about finding a different position so that things are more comfortable, so that there is less pressure on the stoma or the bag. But yeah, conversations are the key to it.
Yeah, absolutely. So we've got 5 minutes left, and I'm just having a look. Hopefully we've covered most of the practical things. I mean, we've got one talking about clothing, but I think, you know, you alluded at the very beginning is where you position the stoma bag is obviously important for where you might have tight clothing and waistbands.
Yeah, and having a stoma doesn't mean you can't wear tight clothing. A lot of people do. The stoma will still work. When you first have your stoma formed, if things are a little bit tender, then yes, some people wear looser clothes. But longer term, as things settle down, you should be able to wear your normal clothing. However, yes, if we can sight it, we don't put it on the waistband because that tends to be the tightest area, and it can just be uncomfortable, but you can wear tight clothing. And a lot of people like to feel that the bag is supported, so they'll maybe put their underwear over the bag. Then maybe if they want to make sure it's covered, they may wear a camisole or a vest or vest top just to go down and have a longer one that goes over the bag as well, because sometimes that makes people feel secure, that there's these layers that are just keeping the bag close to your body.
That's so interesting, because I'm just having a quick look at some of the questions that we got in, most of which we've answered. What is the best way to prevent sores? And that clearly is making sure that you're getting it cut and fitted correctly. I now know that. And what is the best underwear to support it? So I understand from that, that's what you're saying, is that people are looking for underwear to support the stoma bag.
Yeah, and not everyone, by all means, again, everyone's different, but yes, a lot of people will look for maybe wearing pants or underwear that's a little bit higher, because then they can pull it over the stoma bag, rather than if they were wearing very low underwear and the stoma bag sort of hangs free. But everyone's an individual, and again, I think you alluded to it before, it's what you feel comfortable and confident with is the best thing for you. Some people just like a little bit of support, so they'll go and get even a quite elasticated support wear that they feel really helps hold their abdomen supported as well after having surgery.
There's two questions that I'd really like us to answer quickly, if we could. Why do I keep having to get up so often to change it at night time?
Yeah, some people do have this issue. And there can be various reasons for that. So it could be the amount of output or the liquidness of the output. It could be sometimes people get a lot more wind into their bag. Some simple things you can do are to look at when you're eating your meals. Some people, if you're eating quite late at night, then the stoma becomes very active. So whether you can eat a little bit earlier in the evening, some people then change and maybe have a bigger meal at lunchtime and a lesser, more of a tea in the evening. Sometimes it's about looking at what you're eating. Are there things you can do that thicken the output? We know people frequently take Imodium, which is a common medication to help thicken output. People use it when they have diarrhea, and people with an ileostomy often use this to help thicken their output. Again, this needs to be prescribed by a GP, but you can use it to titrate. So sometimes at night, if people are having that experience, I will suggest taking some Imodium when you have your evening meal, and then maybe repeating another dose before you go to bed. And it just helps to thicken the output so you don't get such an amount at night, and hopefully then you're not having to get up and empty it.
Right. I can see that, that's sort of great advice for somebody, because once again, everything sort of rolls into one thing, and we know how important sleep is. And if your sleep's disturbed, then you feel that your condition's got worse, you'd lose confidence, and
you're anxious then, because you're always worried if you oversleep. So there are certainly lots of things, and if simple changes don't help, then again, speak to the stoma nurse who can give you different steps. And we often say, try one thing at a time, and then we can keep coming back with different solutions to help.
Thank you. Well, on that note, I think that we've very sadly run out of time, because I feel that we could carry on talking. I feel that we could go into each of these individual things far more than, and I know that we've sort of scratched the surface, but hopefully that's given lots of people a starting point as to where to now go and get more help and understand more in depth. And the first thing to do is to phone a stoma care nurse.
Yes, yeah.
I'm not suggesting phoning you all the time, though.
No, but lots of stoma nurses out there who are more than willing to help, and give advice, because often asking that simple question at the start saves yourself a problem, and ultimately then means that the stoma nurse isn't having to do extra visits for you. So it's a win-win for everyone. But yeah, we're very happy to give advice and support.
Well, thank you so much for joining us. If you do have any further questions, please keep looking on Talkhouse, where hopefully we can answer some more. We do have, unfortunately not till July, but we do have a bowel clinic. We might have some more things in between, I can't remember now, but do keep an eye out on lots of our practical help. And once again, a big thank you to CliniMed and SecuriCare for supporting this event today. Thank you. Thanks very much, Caroline. Bye, everyone.
Bye.
Bye.